Santa Maria, Santa Teresa, Santa Anna, Santa Susanna, Santa Cecilia, Santa Capelia, Santa Dominica.
Here's your host, bringing joy worldwide, CharlaAwakened.
Well, hello. This is Charla Anderson. Hey Ed, I got some reverberation. This is Charla Anderson with CharlaAwakened for such a time as this. And this time is December 3rd, 2015. And the time, I blinked my eyes and it's almost gone. I just can hardly believe how fast the time goes. And I'm very, very grateful to have had an amazing year and have met so many wonderful and amazing, interesting people this year. And through this radio show, this platform at Radio Star Worldwide, I want to thank Ed, my producer today, to have just always there. Blade, my normal producer, has a little baby, so shout out to him. And the whole team out there in Scottsdale, Arizona, where the Radio Star or the Star Worldwide platform is. And so my show is CharlaAwakened, and we talk about every week just loving people where they are and loving them through it, and trying and just helping people to understand and trying to find some resources that may make a difference for them or for you listeners to just wake you up a little bit, to see where, what's different, what's happening in our world. And the unsteady times are happening all the time, and we want to make sure to just be aware of what's going on, and remember to love yourself. And love is my theme. I believe unconditional love is huge, and we must remember to just love people where they are, without judgment, without strings, and without which is unconditional love. It gives us complete freedom in them too. Today I have a really special guest. I often have holistic healers and wonderful holistic healers that are doing amazing things out there with stones and different things. And I'm excited today to actually have a medical doctor, Dr. John Sklar, who will be talking to us from a medical perspective that also incorporates the whole body, the mind, spirit, and body. And his specialty is chronic pain. And so I'm going to have Dr. John Sklar, and I'm going to spell it S-K-L-A-R, johnsklar.com. You can find him and see how that works. What's he all about, and there's a lot of great information on his website. But I have Dr. John Sklar sitting here right now, and I like to ask, who are you in this world, and then a bit about what you do. So how are you today?
I'm fine, thanks, Charla. So, that's a big question. Who am I? I heard a joke once where, someone was talking to God and asking that question, who am I? And the reply came back, who's asking? So, that's a big question. So, as you ask that, what comes to my mind is I'm a man that's looking for God. That's who I am. And we had lunch before the show, and as I said, once upon a time I used to look for God in all the wrong places, and now I'm looking for God in some of the right places. Not that there's such a thing as wrong and right places, of course, but that really is, it becomes increasingly clear to me that is why I'm here. I'm here to find God. And you were talking earlier about unconditional love, and unconditional love is a quality of God. And so when you talk about unconditional love, I hear God. So we are here to love ourselves and to love each other and to love God. And that's the kind of man I am, and the kind of man I want to be more and more. that could be a challenge for me if I saw the world in boxes where, I can look for God in this place as opposed to this place, and I don't see the world that way. And so I see my whole world as a place that I can look for God. And so coming around to my professional life, that's really what I do there as well. As we've been talking, we've talked about the idea of a person's illness maybe being an opportunity for them to find God. And I really believe that's true. And I've had some illnesses myself, and I believe those illnesses are an opportunity to find God. So what I do in my professional life, I call my approach spirit, mind, body medicine. And certainly there's more to it than finding God. And that's an important part of my medical practice. So I use the platform of a person's illness, specifically people come to me with chronic pain, as an opportunity to move them in that direction of finding God, and finding connection, finding reconnection in their lives. So I guess the neat thing for me is that my professional life and my personal life, my who I am, crosses boundaries for me, and it's not just what I do in my spare time, it's what I do in my professional time too. So I'm a man looking for God in some of the right places, and I do that in my professional life as well and help my patients to do that.
And God is everywhere. He's inside of us, and He is everywhere. So when you're looking for, and it's the old song, looking for love in all the wrong places, right? And then looking for God and love, which are synonymous. And this is something I say a lot, that there's nothing that you can do to be loved more or less by God. God is love. There's no variation in that. He doesn't see anything but love. And if you aren't feeling that love, then that's your own projection and not His. God is love. And so I love that is a definition of who you are.
Yeah, and it's really about remembering, isn't it? So as you said, God loves us all the time, full on, 100%. And in the busyness of our lives, we forget. And so it's really about a remembering. This is a process of remembering. It's not about finding something new. It's about finding something old that we forgot about. It's kind of like finding treasure in the attic, looking through those old boxes. So God's there. We've heaped a lot of other stuff called life on top of God, and in that process, sometimes we forget God. And when we forget God, our lives become chaotic, our minds become chaotic. And to me, this is really the process, I believe, where illness starts, is in that forgetting. So we get busy in life, we forget God, and then the mind becomes chaotic. Because as a little, small, insignificant human being, even though I'm connected to all that is in God, I know that I'm small and insignificant compared to planets and stars and the vastness of the universe. I'm a speck of dust. And when this speck of dust knows that it's connected to all that is, God, this speck of dust is peaceful and happy. I can be peaceful and happy when I remember that. When I forget that, I can become stressed and worried and ill at ease. I can go into a state of dis-ease. And when my mind then becomes chaotic and dis-eased, then the body really has no choice but to follow into that dis-ease. And I believe that's really the path, where our illnesses come from. And it's not about, it's not about, and I don't believe this is a process of wrong and right. I don't believe it's right to remember God and wrong to forget. I think what happens is we go away from God so we can experience what that's like, and then we can choose to come back or not come back. I think everyone chooses to come back eventually, probably, but we can stay out in the cold as long as we want, and then one day we remember and we come back and we come home. Kind of like the story of the prodigal son. We come back home and God says, "Hey, welcome home. Where you been?" And so we can use any problems that come up in life as that catalyst for the remembering of God. And I try to help my patients use their illness as that catalyst.
So when I was looking through your website, I was like, whoa, so many of your beliefs and so many of your philosophies are so many things that I believe and I have said and talk about all the time. And one of them, I keep saying I want to get it drawn out professionally, but I have a little symbol in my head that is like when you love God and you love yourself and you love people without judgment, with no strings, unconditional love. That's freedom for us. It's pure freedom. And so where do we begin with that? It begins with gratitude, and it requires forgiveness. And then what you just said is what I usually say is usually we've got to forgive ourselves for forgetting who we are, that we are powerful beyond measure, that we have all things, that we have the authority in us to do all things, that what Christ did and more, because he gave us that authority. And so that forgiveness of others and of God and of ourselves is huge, and forgiving of ourselves, not for what we did wrong, but that we forget that we are so powerful. So that really reminds me, what you said is exactly what I have this drawing in my head about making that on paper somewhere, put it out there, because I believe it's critical. It's critical. It's a critical piece.
It really is. And, when we talk about this remembering and this coming back to God, coming back home, it sounds so simple. And it is a simple idea. And the process of that coming home and remembering, and as you mentioned, forgiving, and all of these things, it's very complicated, actually. So, it's an easy thing to say and an easy thing to talk about, and maybe not so easy to do. And it's really a process. I like the great psychiatrist and psychologist Carl Jung, and he says a couple of things that I like. One is, he says that all illness represents some sort of spiritual disconnection, and all healing must encompass some sort of spiritual renewal or rebirth. And I think he's correct, and that's what we've already talked about. The other thing I really like about Jung is he says that there's not a doctor and a patient. There's just two people struggling with the same problem.
Uh-huh.
And that's really kind of the approach I take with my patients is, I may have walked some of the path that they're going to walk ahead of them, and I'm still walking that path and still learning and growing myself. And so we're really both in the struggle together, myself, the patient, really everyone I come in contact with. We're all struggling with something, and we're all in that struggle together, and it's the struggle to remember. And so, what I was led a workshop not too long ago, and I told the workshop participants in the setup for the workshop, I said, so what we're going to do is we're all going to put our shoulders on a boulder, and we're going to see if we can move it together. And so, I just really like that concept of no doctor, no patient, just two people struggling with the same problem. It's like there's this big rock in front of us, and we want to move it. And we all benefit when it moves. And what it requires to move is it requires all of us putting our shoulder onto that rock and giving it the old heave-ho and working together. And so we really all are in this together. And I like that concept. So I really like working with patients as a guide to moving their particular boulder. And I'm glad to help put my shoulder up against it and help move it with them. So it really is a collaborative process. Healing is a collaborative process, a cooperative process. We don't heal by ourselves, we heal together. And when I heal, the world heals, everyone heals. And when one of my patients heals, everyone heals, and I heal. And so it really is a nice cooperative process, and quite an honor to be able to engage with people in this way. So.
And you're very well known in the Fort Worth area and probably North Texas, I would think, as Dr. John Sklar. And how do you, I would think in integrating the medical into this more metaphysical world that's not the way you were trained in medical school, is my assumption.
That's correct.
And so the managing of that, the finessing into stepping into this a little bit outside the normal MD realm, how has that worked for you? How is that working for you? Are people afraid of that? Are they looking for that?
Well, I think everyone's different in their ability to understand these things that we're talking about, and so the trick for me is really to meet everybody on their level. So, as part of my initial interaction with a patient, I have to assess where they might be. You also run into strange and interesting problems along these lines. For example, I'll have people where I'll start talking to them about these concepts and to start mentioning the word God, and then, come to find out they'll say, well, I'm an atheist. And so that's always an interesting curveball to hit. And of course, where I'll go there is I'll say, well, I understand you don't believe in God, but do you believe there's something more than meets the eye out there? Is there something?
Energy?
Is there energy? Is there something? And oftentimes then around connecting with God, I'll tell them, well, maybe sitting in nature would be a way to connect with God. So you can connect with nature. If you don't want to connect with God, connect with nature. So, but that's really the art of what I do, is to try to make this acceptable, this idea acceptable to anyone I might come in contact with. In your question, I'm hearing maybe a question behind the question of, well, how does this work with the medical community? And again, that varies. There's some doctors that would completely understand everything we've talked about so far. Those ones would be few and far between, I suspect. There's some doctors that would accept this at some level. There's some doctors that their approach would be, listen, I just want you to take care of this patient. I don't really care what you do, and I don't really want to know what you do. Just, it's always frustrating for a doctor to have a patient come into their office time and time again with the same complaint, and nothing that doctor does is working. And that oftentimes happens with somebody with chronic pain. So if they know that, whatever it is that I do, even if they don't know what it is that I do, might help their patient, then they're willing to let me try. And so there's a varying degree of acceptance of these types of ideas in the medical community, and a varying degree of acceptance in the patient community as well. It used to upset me that maybe there were approaches that were used for this type of a problem that weren't that effective, yet they were used over and over again. And what I've come to understand is that for some patients, that is what they want. Some patients just want their pain pills and want to have their pain pills and use their pain pills and just be on pain pills for the rest of their life. And that's as far as they want to go with their treatment of their chronic pain. They don't want to know about the spirit, mind, body connection or any of that stuff. They just want their pain pills. And if that's where the person is, I'm a little sad about that, and it's not up to me to change their life path. That's their life path, and maybe it'll change, and maybe it'll never change. And I'm not God, and I don't get to decide for other people what their path is. That's an individual choice. So the trick for me is to be able to individualize my approach for each person, and to have then that person thrive within whatever approach they and I come up with together, with our shoulder on the boulder. as I was talking about. So
The pharmaceuticals, though, you typically don't prescribe a lot of the pain pills because you're working from the inside out, from the mind, body, spirit. Is that right?
yeah, I've actually come to a point where I don't prescribe medication. And I come from a place where I used to prescribe a ton of medication. I was one of the biggest medication prescribers in this area. I knew because the drug reps would come in and paid a lot of attention to me back in those days because I was padding their pockets, as it were. Not overtly, but they had a territory, and when I wrote their drug, apparently that was good for their bonus at the end of the year. So they paid a lot of attention to me back in those days. And what I came to realize, though, is that I didn't think I was helping anybody, and I didn't think I was changing anybody. And what I know with the opioids, we call them, people use the term narcotics, but the correct term is opioids, but which all of these are morphine or opium derivatives, either synthetic or an actual derivative of that plant. These medications might make somebody feel better temporarily. Long term, they cause a lot of problems, and they've caused a lot of harm. So, people know about the Hippocratic Oath, which is kind of the short version of that is first do no harm. And I just felt like I couldn't continue to prescribe medications for people. So if people want medications, there's doctors out there that'll prescribe medication for them, and I have no problem with that going on. I think there's a bigger picture for them to be seen at some point, and I hope they'll see it. And if what they want now is the medications, there are avenues available to them for the medications. And I'm not a doctor that currently believes in prescribing really anything for these sorts of problems. And in my personal life, I don't take anything. I might take some supplements and things like that, but I don't really believe in the pharmaceutical solution for these problems. In my experience, putting somebody on a drug to treat pain, then you create a side effect. A lot of times the pain medications make people tired. So I've seen situations where a doctor will prescribe the pain medication, the person's tired. Now they prescribe a stimulant medication. So you've got this balancing act going on with a new medication to, treat the side effect of the first medication. For my money, I say, well, if the medication's creating a side effect, then stop the medication. Don't add another medication that maybe then is going to create another side effect, and then you have to add another medication. This is where we find the elderly in our country some of these people are on 20 and 30 medications, and I don't think anybody knows what that's doing in someone's body. I mean, we don't have the models out there where we know what 20 or 30 medications does to a person. What we do know, though, is that some of the medications used for pain, especially the opioids, can cause problems, and I'm not willing to be part of that problem on an ongoing basis. I was part of it, and I got myself out of that. So
I used to subscribe to a little magazine and a little bitty one. It had all these little ads. Most of it was ads with pages and pages and pages of disclaimers for what the pharmaceutical, the pill would do if you took it. And I have just, my birthday was this last week, and I got to, very happy that I am as healthy as I am. And I was flippantly saying to you, I don't believe in getting sick, so I don't. And I do believe that that's a lot of the reason that I don't. I just don't believe in it. Does it mean never? No. But I'm not taking anything either, and I just entered the Social Security years, right? So I'm here, and if I would have a hard time finding something if somebody wanted something, a pet for their headache at my house. I just don't have it. So I consider myself extremely blessed in that way, just because what a blessing to not have to I never started it. Oh, well, years ago, your cholesterol is kind of high. I'm like, no, I'm not taking a pill. I'm sorry. I'm not going to get on something that I'm going to have to stay on for the rest of my life, and I'll work with it or live with it. I'm not. I just didn't do it. So, for me to find a medical doctor that also has that similar philosophy is really powerful to me. And we have because I have all these friends that are spiritual healers and energy healers, and they do miracles. Really, there's a lot out there, and it all comes from loving yourself. And we started out with the love conversation.
Right. And I think, I think part of loving ourselves, we all know the concept of tough love. And what I want to say is that, there's a level of responsibility and accountability that we have in our lives. There's things that we need to take care of in our lives, things we need to do. Like you were just talking about love. We need to love ourselves, or it would be a good idea if we love ourselves. We don't need to do anything. There's no rules. It's a good idea to love ourselves. I'm kind of grasping for the words here. What I want to talk about really is that the approach I take, the treatment approach I take for chronic pain, is one of the person that has the pain becoming responsible for their pain and their life with that pain. What the medical profession does in many cases, especially around chronic pain, is it allows the person that has the pain to say to the doctor, you know what, this is your problem, doc, and fix it. And so when you go to a doctor and you do that, you end up with pills and shots and surgery and things that may or may not help you, and things that definitely aren't helping you by way of taking responsibility for your life. And so what my treatment approach is, and the person that it's for, is a person that says, you know what, I want to be responsible for my life, and I want to be responsible for my pain. And can you help me do that? And when I get that person in my office, boy, that's a marriage made in heaven, Not that I marry my patients typically, but that's a partnership made in heaven, because that's what this process is about. It's about, how do I become responsible for my pain? What are the things that I can do in a practical sense that will help me with my pain? And so there's some answers around that. I'd like to kind of get nuts and bolts here with the listeners.
I would love to get nuts
and say,
bolts.
So here's what we do. And I call what I do body, mind, spirit, or spirit, mind, body medicine. Most people turn it around and do body, mind, spirit, but for me, spirit is where it all starts, as we've discussed already. So spirit, mind, body medicine. Typically, however, when I'm laying out a treatment approach, I start with the most concrete area, which is the body. And in the body, what's important is movement. We've all heard the old phrase, if you don't use it, you lose it. And so what happens to people with chronic pain is they become afraid to move, and then they stop moving. And then they become deconditioned because they're not moving. And they don't move because they're afraid of movement. They're afraid they're injuring themselves or damaging themselves, because we're all taught from a young age that pain means you're hurting yourself or there's some damage going on. And it's important for people to understand that in chronic pain, that's not the case at all. In acute pain, if I sprain my ankle, then the pain is telling me you have an injury and you should be careful. If that ankle still hurts 3 months from now, most likely it's healed if it wasn't a really, really, really bad ankle sprain, which happens in less than 1% of cases. And if I still have that pain is not telling me to not move. The pain at that point is probably telling me I haven't moved enough. And so it's really important for people with chronic pain to get moving. And that can be anything. You can be walking around the block. People say, well, I can't walk. I can only walk to the mailbox and back. I say, well, then walk to the mailbox and back 4 or 5 times a day. And then after a week, start walking to the neighbor's mailbox. And, I always tell people, if you can walk 5 steps, then I know tomorrow you can walk 6. And if you walk 6 tomorrow, I think the next day you can walk 7. And if you just add 1 step or 10 steps a day to however far you're walking, I think I calculated it out one time, in a year you'll be walking a mile. And so People with pain need movement. That's the physical aspect of it. You can add other things, massage and other types of body work, and there's all kinds of things that can help. But the main thing is a person with pain has to move. They've got to become mobile again. And typically the pain takes that mobility away. On the mental level, what I talk about is meditation. And again, there's a lot of ways to relax, but what this meditation is about, or what the mental level, the challenge on the mental level is to be able to relax. And so I work with people on meditation, but again, there's a lot of ways to relax. There's biofeedback, and you can buy a relaxation tape. So there's all kinds of ways to relax. And so as we were talking earlier, what happens is stress comes on, dis-ease, we go into a state of dis-ease, and the way to reverse that is then to become easier. And so that's all about relaxing and those sorts of things. I'm going to jump back to the body for a minute. I'm becoming increasingly aware of the role of nutrition in health. I believe that our diets, when they're not right, create stress in the body. And so again, if stress is part of the issue with chronic pain, our diets can be stressful to us. And so it's very important for people to learn to eat right. And again, I think there's some simple principles people can follow. Most people are aware of them, staying away from the processed foods, the white flour and the white sugar, and those sorts of things, and eating healthier things. Certainly there's supplements that can help, although I really want people to learn how to eat foods and be dependent on food for nutrition. Although, as you and I were talking about earlier, sometimes you may not get a certain thing from your food, and if there is a deficiency, a supplement may help. So that's the body and the mind. And then, the spirituality part of all of this is it's a little bit more difficult to define. I think it's different for every person. I tell people that, I think when all's said and done, if there's 7 billion people on the planet, then there'll be 7 billion different religions. This isn't about religion. This isn't about going to church. This is about having a relationship with God. But as we already talked about, you can find that in nature. You can find that in meditation. That's why I like meditation. It's kind of hits on two levels. It's a mental, there's a mental part of that and a spiritual part of that as well. But really, the thing around spirituality is it's about connection. We've become disconnected from ourselves. We've become disconnected from God, disconnected from nature, disconnected from one another. And we talked about God being love. So God is connection. God is love. And so what people need on the spiritual level is to reconnect with themselves, with God, with others, with nature. So disconnection really is the disease, and reconnection is the cure on a spiritual level. And again, that's fairly vague, and I want to keep it fairly vague because, again, this is going to be a different process for each person.
Exactly.
So it is personal. And sometimes people can find that path by, bouncing things off of me and bouncing things off of others. So it is, again, we're back to that collaborative process, and healing is a collaborative process.
That's awesome, and there's so much competition going on in the world, but as we move into the new paradigm, the new things that are happening out here, I believe we're all connected, and we do have a responsibility to love each other where we are and collaborate and not compete in everything. When there's 7 billion people, we're not going to run out of people, so we have opportunities. On your website, I noticed too, you really have a lot of tools. JohnSklar.com, SKLAR.
Yes.
.com, and you've got meditation tools. You've got testimonies, and some of the testimonies pretty remarkable. And I wanted to bring one up, this testimony that says click here for more, and I actually did, and then I printed it out. I was like, whoa, because it tells exactly what the process he or she went through, and And then one of the things you told this person was to love the pain. And so this whole the idea of what you focus on, you get more of, right? So if you're focusing on pain, you're going to get more pain. So how does that work in your world?
Yeah. Well, again, I think that when we resist something, we actually create pain. And so it's not the experience that's painful. It's the story we tell ourselves about the experience that creates the pain. So for someone in pain, that story might be, I've got this pain, I can't do this, I can't do that, it's never going to go away. The doctors have tried everything, and I'm just stuck like this, and my life is terrible, and they have this story on and on and on about how this is just a terrible thing, and it's and all of that is really resisting what is. And so where somebody could go with that is they could say, and what I tell my patients oftentimes is that the fact that you have pain means that there's an imbalance in your life. That's really all the message is. It's not that you're a bad person and you've done these things wrong and you're being paid back, and people have all kinds of ideas about this stuff. But the real message is there's an imbalance in my life. If I have pain, there's an imbalance in my life. And so then the pain can become a teacher in that way. And, instead of, what some people go to the doctor and they say, get rid of my pain. Well, that's akin to them saying, kill the teacher. Well, instead of killing the teacher, what we could do is learn the lesson. And so, and if that process and when that process occurs, then the person really, their pain can become their friend as opposed to their enemy or their tormentor or their torturer. And so it really is, it can be something that you love. And sometimes we all maybe have heard the saying, fake it till you make it. So from the person that still has the pain and it's still, compromising their life in this way and that way and this other way, it's hard to love the pain. And I just tell them, I want you to love it anyway. I want you to start practicing loving your pain. And as they can do that, and as they'll start to then have less pain, then they can love it more, and the love will become easier as they realize that, oh my gosh, my pain taught me this, or my pain taught me that, or, looking back on it in retrospect, 5 years later when you haven't had pain for a while and everything, the treatment has worked, then it can be easier to love the pain. But that's not easy to do in the moment. Where I go with this sometimes is we've all been in school, some of us just through high school, some through college, and we've all had easy teachers and hard teachers. And thinking back to school, everybody hated those hard teachers. Oh, Miss so-and-so, Mr. so-and-so, boy, they're a hard teacher. Boy, they're just wrecking my life. They're, giving us all this homework, and I don't have time to do this and that. And, boy, I wish I didn't have that class with that hard teacher. But from where we sit now, 5 or 10 years after that class, what we realize is that hard teacher actually probably taught us the most. And so then we can love that hard teacher that everybody hated way back when. I think our pain...
What doesn't kill you makes you stronger, right?
Yeah, absolutely, absolutely. And so, with our pain, it's no different than that. The pain is a hard teacher. And I think when we learn the lesson, then we'll see that it was just a really, really valuable lesson. I mentioned getting nuts and bolts a minute ago, and I want to get even nutsier and boltsier here for a moment, if I might, because we've kind of done this interview in kind of reverse order. We've started with the spiritual level, and I said when I talk with my patients about treatment, I start where it's concrete with the body. We've kind of gone in the reverse order. We talked about spiritual, we've talked about mental, we've talked some about the body. But I really want people to hear some things and understand some things about their pain. And when I talk about pain, what I see mostly is people with back pain and neck pain, because that's what most of the pain is out there. I do see people with arm pain, leg pain, headaches, abdominal pain, all these other different kinds of pain. And what I've seen most over the years is people with back pain and neck pain. And there's some real misconceptions out there about back and neck pain, and I really want to take a minute and dispel some of those. And the biggest one is that back pain and neck pain are structural. Where people with pain oftentimes have come to in their search for relief is that I've got a herniated disc and that's causing my neck pain, that's causing my back pain, or I've got degenerative disc disease and that's causing my neck pain, that's causing my back pain. I have an annular tear, and because typically when people have pain, one of the first things that's done is some sort of imaging study like an MRI, and then the MRI shows some things that aren't quite normal, or we have this idea that they're not normal, and then those things, that's where the pain is pinned on those structural changes in the body. What people need to know about all of this is that bulging discs, protruding discs, degenerative discs, herniated discs, these are all part of the aging process in the body. I tell people it's like gray hair on your spine. And just like gray hair on your head doesn't hurt, these aging things in your spine really don't hurt. The way we know that is they've done studies where they take 100 people with pain, 100 people without pain, and do MRIs on them all. And what they find when they do that is that the two groups of MRIs are identical. So in the group with pain, there's some people with no change on the MRI, there's some people with mild change on the MRI, some people with moderate change, some people with severe change on the MRI. In the group with no pain, we find the same thing. No change, mild change, moderate change, severe change. So there's people out there with terrible back pain and neck pain and no change on their MRI, or very minimal change on their MRI. There's people out there with severe changes on the MRI and no pain. Okay, and so what we know from these studies is that these findings on MRI are not the source of pain. I won't say never the source of pain, but I'll say 99.9% of the time, not the source of pain. We learn in medicine never to say never, because just when you say never, that thing you said would never happen comes walking into your office. So I won't say that those changes are never responsible, but I will say that in most of the people out there with chronic back or neck pain today, it's not a structural spine problem. And again, I say that not because it's my opinion. I say that because the evidence in the medical literature says that. People may have heard the term evidence-based medicine. There's more and more of an attempt these days to practice medicine in an evidence-based way, which means we don't practice medicine when we don't have to, as if all that matters is my opinion. We practice medicine looking at the research that's been done and what the literature says, and we say, well, what does the literature say? And if you ask me, Dr. Sklar, what does the literature say about back pain and neck pain? The literature says that back pain and neck pain, we're talking about chronic pain here, more than 2 or 3 months in duration, is not related to the structural abnormalities that we see on your imaging studies. And this is a very, very important idea. So, a lot of times people with back pain and neck pain have had an MRI, and the MRI says, you have this degenerative problem or that degenerative problem. And so the idea that they get in their head is that I have a bad back. We use this term. What's wrong with you? I have a bad back. Okay. What that typically translates into is that I have some sort of degenerative thing that's been seen on imaging in my back. And the notion I want to dispel in people is that having a change on imaging doesn't mean you have a bad back. It just means you're older than you used to be. So we start to see these degenerative changes in teenagers. So maybe 5 or 10% of teenagers will have a degenerative change on their MRI. As you move into the 20s and 30s, it's about 20 or 30% of people will have that degenerative change. As you get into the 50s and 60s, it's 50 and 60 and 70% will have that degenerative change. And people in their 80s and 90s, 80 and 90% of them are going to have degenerative changes on their MRIs. Yet we know that everybody in their 80s and 90s doesn't have chronic neck and back pain. So, it's just very important for people to understand that their spine is not the problem in most cases. And then that's where the treatment kind of triggers off of that idea, because if I don't have a bad back, then there's no reason why I shouldn't be out there moving and walking around the block today. There's no reason why I shouldn't lift what I want however I want to lift it. There's no reason why I can't go to the grocery store and bring a couple of bags of groceries into the house out of the car, or from the shopping cart to the car when I'm at the store, because I don't have a bad back. And this, if your listeners can take anything home from this discussion today, it's that if they have chronic back and neck pain, they don't have a bad back or a bad neck. And there's no reason for them not to be active, and there's no reason for them not to be able to overcome their pain. That's the other thing that these structural abnormalities do, is if I have a structural abnormality in my spine that's causing my pain, well, there's no way to fix that. Even if I do surgery, I'm going to make a new structural abnormality in the spine to fix the old structural abnormality. So if the structural abnormality is causing the pain, then there's no way out. And so what I'm here to tell these fine people that are listening is that there is a way out. And the reason there's a way out is because it's not your spine that's the problem. What happens, so if it's not the spine, then what is it? If you look at my site, what you're going to see is information about a man named John Sarno, MD, who coined the phrase tension myositis syndrome. And what Dr. Sarno realized after practicing for a while and having poor results with his patients, like many people that use a structural approach have had, is that the chronic back and neck pain is not a structural problem, as we've just discussed. That what happens is that repressed emotions in the subconscious mind come out as tightness in the muscles, pain in the muscles. And so people have repressed emotions or stress in the mind, and that's expressed as pain. And so what I want your listeners to hear is that if they do suffer from chronic back and neck pain, most likely, almost 100% certain it's not the spine, and I'm almost 100% certain that what the problem is that they've had repressed emotions build up over the years. They haven't dealt with them, because who knows how to deal with them particularly well. Most people don't. And so the emotions have built up, the stress has built up over the years to a point where it has now become expressed as a symptom in the body. And that is the cause of most chronic back and neck pain. So these repressed emotions expressed as painful, as a painful condition in the body. That's what causes it. It's as if the person is. It's as if the person is. Their life hurts. But, if someone says what's wrong with you and you tell them my life hurts, they're going to kind of look at you a little funny and say, really, your life hurts? Well, okay.
Yeah.
And that might be the last time
Then
you talk.
we go to see a shrink.
Yeah, that might be the last time you talk to that person, right? So it's much more acceptable to say my back hurts. But really what they're saying when their back hurts is my life hurts. I've got stress that's built up over the years, things that I haven't forgiven myself for, things that I haven't forgiven others for, and those are the things that cause the chronic pain. So it's not a structural problem, and there's a spirit-mind-body interaction that's responsible for the pain. And the great news is that can be undone. And so the last thing I really want everyone to hear is that I've had people with 20 years of back pain become pain-free in a month or two. Even when they've had back surgery, even when they've been on the chronic narcotics or the chronic drug treatments. But I have seen people many times, and it's really a miraculous thing, quite honestly, to see someone with 10 or 20 years of pain become pain-free. To see somebody that had huge limitations on the things that they could do in their everyday life become unlimited again. And I have seen that hundreds of times. And so, This isn't some theory that I'm testing out, the things we're talking about today. This is a tried and true method of treating chronic pain. I've seen it work for many people. I'm sure in my career I'll see it work for many more. And I have seen people recover their life through this process of spirit, mind, body medicine to become fully functional, whole again, and be able to resume all of their normal activities and all of their normal lifestyle, even after surrendering those 10 and 20 years earlier. So it's really quite an amazing thing, quite a privilege to be able to work with people in this way and see these things. And I certainly am available to help anybody that might be hearing this and might be thinking that this type of approach would help them. So,
Are you only is that only in a physical office, which you have here in Fort Worth?
That's correct. Yeah, I mean.
And we only have about 3 minutes
Yes,
left. This is so fast.
Yeah, so that's correct. I have an office here in Fort Worth, Texas. The information is on my website. I'm in the phone book, and I'd be glad to work with people.
It's a holy mindset to consider that my stress and my repressed emotions are causing me pain, and because the pain is a feeling, and people feel the pain.
The pain is real.
The pain is real.
Yeah, I'm not saying. I don't want people to hear that I just said their pain is in their head. What I said is the source of their pain is in their head. If that's where our emotions are, I think it's maybe more our heart. Mm-hmm. Their pain is in their heart, actually. But the source of their pain is in their heart. But the pain in the physical body is 100% real pain. I'm not telling people they're imagining that they have pain. I'm just telling them that they have possibly been misled as to the source of that pain. And again, I want everybody to hear that the great thing about this diagnosis is it's treatable. It's curable.
That's unbelievable. It's so beautiful to hear that. It's so wonderful to know that there are resources out there that are not here, take a pill, and my favorite color is purple, so I want the purple one, right? Or whatever that happens to be that the advertisers have, the marketing out there has contributed to our way of looking at that. I don't know why I'm echoing here on the phone, but anyway, so that it's just such a fast hour here that we have, and I have to need my glasses on to see what time it is, but I think we've got about 3 minutes. And so is there any, Dr. John Sklar, sklar.com, and it's actually johnsklar.com. It's not doctor
right
in front of it. Okay, so they can find you in Fort Worth, Texas, if they want to come and talk to you personally and get your assessment. And wow, your philosophy is so closely aligned to mine, and that we've sold out so much to the pharmaceutical industry, and I'm really grateful that you personally have taken a stand for that, and that we're moving in that direction in many ways, and and combined with some of the other things that are going on, and So, Dr. John Sklar, is there last word? Because
well, just for people, look at the site, johnsklar.com. You can get Dr. Sarno's books, and they're on the site. Dr. Sarno, Sarno, wrote a book called Healing Back Pain, The Mind-Body Connection. Very good summary of what we've discussed today. The literature evidence is in that book. So,
you have a lot of resources on
on the site, and I encourage people to look at the site, look at the books, and if you want to talk, because some people read the book and are healed. Some people might look at the site and be healed.
I love that, and so thank you very much for being my guest today, for taking the time out of your busy schedule to meet with me and to share your amazing wisdom with the people out here, and who knows how far it goes, but that's what we're here for, to make a difference every day in someone's life, and I see that you do that all the time, and I'm really grateful to have gotten to know you recently, and we'll do this again, hopefully, and I hear I'm assuming there might be a book. I can't imagine that you don't have a book in your little repertoire coming through sometime soon.
Maybe so. Thanks, Charla. This was fun, and look forward to seeing you around and maybe doing another show at some point.
That's awesome. So, Ed, we are just down to the last minute here. So thank you very much for everything. Thank you for, what we do here is spread joy, spread hope, spread encouragement, and that's my gift, and that's who I am, and that's what I always intend for you to do. So always, don't forget, we're always going to choose joy. So thank you, Ed. Thank you, Star Worldwide, and thank you, my friends, Danny.